Welcome back, everyone. As you can see, we're in full COVID attire at the moment. Mark and I are going to get back to you and bring you some more informational content now that you're in the peak golf season. This is typically where I see as well, Mark can comment as well, is where golfers who do their off season, they stop training in the on season. They pretend that golf is going to make up for all the deficits and all the exercise you do, and you lay off the pedal in terms of your on season training, and then you get these injuries creep up. So my goal today is going to take you through kind of the 5 most common injuries we see in amateur golfers, things to look out for, what you can do to address it, and when you need to seek some attention to take care of it. What do you see with people in season, Mark?
They don't exercise as much as we would like, and they think that fitness is their golf, and that's what happens. That's what happens. They get injured. And that's what we don't want to see. We want you to maintain your fitness level throughout the season so that we don't get injured and that you do play your best golf.
Number 4 on the list is knee injuries. And once again, it's not exclusive to one side of the body. It can be right side or left side for a variety of reasons. Kind of the top 3 types of knee injuries, you've probably all heard this if you're watching any kind of sport, not only golf. We're looking at ligamentous injuries, ACL, PCL, MCL, and LCL. Then you look at kind of tendonitis, whether it's patellar, quadriceps, or hamstring tendonitis. And last one is meniscal, kind of the cartilaginous surface around the knee, providing shock absorption and kind of increasing some of the stability in terms of rotations. We all know a couple golfers who've gone through kind of knee surgeries and scopes because of a lack of structural integrity around the knee. So kind of 3 big reasons for knee issues is, we covered this before, is swaying, sliding, and then the first one we haven't really covered is a forceful knee extension in your trail leg. So let's talk about swaying and sliding first. So sorry, Mark. Yeah. So go into a sway. Okay. So sometimes this causes torque on the medial surface here, on the lateral surface here in a swing, and then a slide, putting a lot of force again through this surface here, and depending what happens on that right foot. Some people like to hang back. Show me what a hang back looks like. Come through and hang back. Exactly. There's a tremendous amount of force here because you're not getting on his toe. So there's a lot of medial force here, but if he gets on his toe, that force goes away because you're allowed to rotate on it. And the last one is a forceful trail leg extension. And it's kind of neat to see. So in a typical swing, go ahead, Mark, he maintains this posture. He rotates here, he has this flex. This quad, this hamstring, this calf is doing the job of holding that knee in position. But then when you go in a forceful trail leg, that knee's almost locked out. When you lock out a joint, you rely less on the force closure, the muscle around the joint. You rely more on the form closure, the actual joint integrity, and that puts a lot of strain on the joint. So if you're taking a look at what might cause your knee injury, it could be the left side if you're sliding, it could be the trail side if you're swaying, or even a forceful knee extension. Totally opposite for left-hand golfers, and I apologize, but I'm a right-hand golfer, and this is how I think.